While I was there in the classroom, I thanked the students in advance. I told them it's very unlikely that I will be able to actually talk to you on food distribution night. You know, my job is to be the solve whatever crisis there is person, and I don't actually stand around and talk very much. One woman from that class worked her 3 hours. Then she tracked me down all over the building, and if you guys know Wesley, it's like a block long and it has 2 floors and big parking lot. This woman tracked me down all over the building to hug me and tell me with a shining face what a difference this volunteer opportunity had made in her life. And it did make a difference. She volunteered every month for the next 2 years until she graduated and left town. I don't know that I ever spoke to her again other than to say hi and, wave across the room. But I can remember that day so vividly. I can tell you what the weather was like. I can tell you what I was wearing. I can tell you what she was wearing. I can remember what her voice sounded like. And the awe on her face that she had recognized her connection with the rest of humanity. And at that point, I knew that somewhere in there, God had been at work, and I had seen God's reflection. So thousands of people have volunteered at Wesley Evening Food Pantry. We get about 1,000, 1,200 new volunteers every year. Volunteers include clients, former clients, blind people, people in their 80s, middle school children, people of different faiths, gender, sexual orientation, color, every kind of difference that you can imagine. The pantry has given a week's worth of groceries to almost 60,000 people in our community. And those of us who started in the fall of 2006 joke about the first night when we served 5 people, and there were more volunteers than clients, and everyone clustered around the clients and wanted to be the person who got to help. But it really started when I heard about a need, much in the same way that Avicenna started because Dr. Armand heard about a need. So I do one thing. I do food. I do it in one place, not a national program, one place. I do it in Champaign Urbana. For one small subset of people who need help, we're not trying to serve every hungry person in Champaign Urbana. There are pantries that are larger than ours and pantries that are smaller, but people who are working and need a place to go in the evening know there's one place they can go around the 3rd week of the month. And every one of you can do the same thing. Anyone who hears about a legitimate need can figure out that one small thing that they can do to make a difference. Thank you. So we have a couple minutes for questions for either myself or Dr. Armand.
I guess I'll be the opener again. For you, I guess there's the aphorism which I thought was Quranic about give a person a fish, teach them to fish. I don't know if you would go on that anyway. For Dr. Ahmed, this is delicate, but I guess I want to ask it anyway. A friend of mine availed herself of the services at Gina some years ago, and she had a skin problem, and there was no woman doctor there, and she was not satisfactorily examined because of modesty. And it just seems to me that I can't imagine the Quran really says that a doctor cannot give full service to a patient because of some admonition for modesty. But that seems to have been the case then. I don't know if it was a personal situation or
So I'm not aware of it, and that's news to me. There is no such thing patient-physician interaction. And we have the female physician here sitting at the back, Dr. Shaneen Sathe, who is the medical director, and has been there along with several others, who manage patients on a weekly basis.
But there wasn't one at the time.
Yeah, maybe I'm not.
I'm just asking about the admonition. Can't a doctor, male doctor, see a woman?
Yes, I mean, they see it and there's nothing curtailing that. And so actually, regardless of one's faith, regardless of one's origin, and you can see them working not only in Avicenna, but elsewhere in Khan and Provena and all over the country and all over the world.
So I'll answer the other part of that just real quickly, which was the give a man a fish or teach someone to fish. And as Kristen mentioned in the introduction, we are certainly in our other services that we were providing while people were waiting, trying to give them tools for changing whatever it is in their life that is causing the need for food. But I'm not trying to, like I said, I'm going to do one thing. If people who are working and they're getting along just fine, their budgets are fine, they're getting along just fine, and then somebody gets sick and can't work for 2 months, and now they're in a crisis, we're going to give them food. And most likely, 2 months from now, they're not going to need the help again. So I don't think that we're setting up a system of always needing for me to be the fisherman.
I have a question. You could say a few words about where the food comes from.
95% of our food comes from Eastern Illinois Food Bank. We are a member agency of Eastern Illinois Food Bank, and so we get food at greatly reduced prices over at the grocery store, for example, but we do have to pay for that food, which many people don't realize. Our food costs are $5,000 to $10,000 a month from Eastern Illinois Food Bank.
You said anyone can do what you do. I think you're being modest. But my question has to do with other sources and agencies right here in this county, maybe region. I'm actually impressed with how many different agencies and sort of resources are available. Do you have any network? Is there some sort of central organization that could leverage your help and maybe even amplify it?
Well, there are 30 to 40 food pantries in Champaign County, so lots of people doing lots of good work. There's an informal network of food pantry directors, and we talk to each other now and then. There are 3 of us who opened around the same time and trained at the same time, and did our Eastern Illinois Food Bank training at the same time, and we tend to check in with each other. So when I see a huge jump in my numbers, I call them and I say, are you seeing the same thing? And almost always it is the same kind of projection. I don't know that a formal network, I don't feel the need for a formal network, and I'm not sure if I answered the question or not.
Well, I guess the point is, are we sort of reinventing the wheel? Is there something that could be used a little bit more efficiently, in sort of central organization?
I am sure that a central organization would make things more efficient. I think it would not be a service that I would recommend, because the fact that all these pantries are different and do things in different ways means that people who are not comfortable or can't follow the guidelines of one can go to a different one. For example, we are not first come, first served. Because we're open in the evening, when we were doing a first come, first served, people kept arriving earlier and earlier in the day to be first. At one point, we had people arriving at 10 o'clock in the morning, actually taking time off work to be there